Welcome to my YouTube channel. Myself Keyur Limbache. I am a final year medical student from Jimar Sola, Ahmedabad. Today in this video, we will discuss the cardinal symptoms of Parkinson disease. Why we have rigidity, we have bradykinesia, and tremors. Right? So first, let's talk about rigidity. That you all know that our muscles are under control of motor neurons, right? So this is our brain. Here we have some dopamine secreting neurons of basal ganglia. These are the upper motor neurons, or you can say some extrapyramidal neurons, and here is the gamma motor neuron. So the role of gamma motor neuron is that they increase the tone of the muscle, right? They constantly keep on firing and maintain our tone to some higher level. Means their main role is to increase the tone of the muscle. Gamma motor neuron increase the tone of the muscle, right? They are under constant control of these dopamine neurons, which comes from the basal ganglia, right? What is the role of dopamine neurons? These dopamine neurons are inhibitory in nature. So they control the firing of gamma motor neurons. So somehow they maintain our normal tone. But what happens in the Parkinson disease, this dopamine does not secrete properly, or dopamine is depleted. So the decreased dopamine level will increase the activity of the gamma motor neuron, or you can say that will be loss of inhibition of the gamma motor neuron, and that will lead to increase the tone of the muscle, and that will cause the rigidity, right? And the main differentiating feature between this rigidity and spasticity is that this rigidity will be in both type of muscles, like flexor and extensor, both group of muscle, which means they will tightens the extensor as well as the flexor muscle. So when you passively try to stretch the muscle, or you can say when you passively try to flex the muscle or extend the muscle, you will feel a resistance during the whole movement. Why? Because both side muscle are or both muscles are hypertonic. So because of this, during all the movement of the whole movement of muscle contraction, you will feel some resistance, and this is called the cog wheel. This is called the lead pipe rigidity. But sometimes in this lead pipe rigidity, because you all know that there is a tremors. Now we will discuss why we have tremor, and then we will discuss about what is the cog wheel rigidity, right? So the second important clinical feature is the tremors, and specifically the you can say when we start the movement of our any muscle, we have the patient experiences the tremor, means the resting tremors. Why? Let me tell you. In the basal ganglia, a lot of nucleus present. One is a caudate, one is putamen, One is this globus pallidus externus, globus pallidus internus, and there is a subthalamic, and this is substantia nigra, right? See, and they all are, then this is a major nucleus, you can say thalamus, right? All these connections all have connection towards our cortex. So what is tremor? First let's discuss what is the main physiology of movement. So the idea of any movement comes first in our brain cortex, means motor cortex. So idea of movement comes in our motor cortex, then it goes towards our basal ganglia, and we have two types of circuit. One is positive or one is negative, which means positive circuit will eventually lead to movement of the muscle, and the negative or the other circuit will stop or will not able to perform activity or perform that particular movement, right? So let's say if you are sitting over here and you want to stand up, so the thought of standing up comes first in your brain. From brain, what actually requires is that which muscle will be used, that your brain must know, right? And the initial firing for that particular muscle group should be initiated from the basal ganglia, which means the early phase of the movement, the whole energy, the whole impulse that eventually lead to contraction of the skeletal muscle comes from the basal ganglia, right? So the first phase, all the impulses will go from the basal ganglia towards your motor cortex, and from this motor cortex your skeletal muscle will act, and during the movement this cerebellum gives the information about the progression of the movement, right? So the first phase of movement are under control of basal ganglia, right? So what happens when there is a mismatch in this circuit? Why there is a mismatch in this circuit? Because of dopamine depletion. Decreased dopamine will lead to mismatch or unopposed firing of some particular muscle. Some will suppress, some will excite. So this will lead to the condition called the tremors. Especially these tremors are called the resting tremors. In Parkinson, in medicine, it is called our finger, first finger, and the thumb. There is a tremor called the pin rolling movement. So these are some tremor, right? I have explained the mechanism behind tremor is that there is a unopposed firing in the basal ganglia that will lead to excitation and inhibition of group of muscles, right? So there is a tremors, right? So till now we have understood the main rigidity. Why there is a rigidity? Because of loss of inhibition of the gamma motor neuron, and the second one is the tremors, right? Because depletion in the dopamine causes altered firing inside the basal ganglia, and basal ganglia, as you all know, that controls the early phase of the movement or the resting tone of the muscle. So there is a tremors. By this knowledge you should know what is cogwheel rigidity. So it's nothing, just lead pipe type of rigidity of muscle plus tremor in the same muscle. So when there is a rigidity and tremor of the same muscle, that will lead to the condition called the cogwheel rigidity. Right? So these are the two clinical features. And other one is the that you all know, that bradykinesia or akinesia. So as I explained earlier, that the initiation of the movement is completely or the mainly under control of basal ganglia. So when there is problem in basal ganglia, there is problem in initiation of the movement, that will lead to decreased movement, that is called the bradykinesia. So these are the cardinal feature and the pathology, or you can say the mechanism why this occur in Parkinson disease, right? So thank you for watching this video.